Hi, my name is Patty Scheets. I'm the Director of Quality and Clinical Outcomes, and I'm here today with Trent Dunlop. And Trent is a physical therapist at Salem Transitional Care here in Salem, Oregon. And I invited Trent to come and talk to us today just about a patient story. I was doing a site visit in Salem, and afterward you came up and said, hey, you've had this really interesting story about this, how we use the measures in handling a particular patient, and I thought it'd be good for everybody to hear. So Trent, we're here to hear your story.
Okay. Well, we had a patient who was with us following a stroke, and we had worked with her for probably a month and a half or so and was making good progress. And suddenly we noticed that the first indication something was wrong was she had some increase in tone. And so we communicated with nursing that there's a tonal problem. And their immediate response was to add baclofen to her regimen. But a couple days later, it was interesting because all three disciplines kind of came together and say, hey, we did our progress note today and we did our standardized testing, and she's much worse. We found out that everybody's standardized tests were much worse. So we were able to use that information to go back to nursing and say, you know what, we don't think it's just a tone problem. We think there's something else going on. And with that information, they were able to go to the medical staff. Come to find she had a UTI, it was treated, and we were able to continue on our recovery process. But we were able to, outside of using that standardized test, we really had nothing concrete to go to them to say, this is what we're seeing, this is the problem that she's having outside of the tone. And it was prior to her UTI symptoms really developing. So we were able to actually treat the issue early on, and she recovered quicker because of it.
That's neat.
So, yeah.
And I don't know if you were able to test her again. Did her measures come back up?
She improved.
She improved.
Yeah.
Wow, that's such a neat story. And one of the things certainly that when we rolled out this core set of outcome measures, we were certainly wanting to be able to follow our patients as a collective so that we would have this large database of patients' information. But this is just was such a neat story about how this information was really helpful in handling this and managing this individual patient. So great. Thanks for sharing your story with us today, Trent.
Yeah, thank you.
We'll see you guys later.